One of the common problems that we see in people is post-car accident injuries, and it's actually something that we see quite often and we treat a lot of patients for. The weird thing is, a lot of times after a car accident, you actually might feel okay, and symptoms might not present themselves until 2-3 days after, all the way up until 2 or 3 weeks after an accident when you first start to notice your symptoms. So what we're going to look at is some examples of x-rays of patients that have been in car accidents and what we look for to analyze any sprain, strain, or whiplash injury. This picture here is an example of the proper motion that your spine should have when bending to the side. This patient here is bending to the right. Although they don't have perfect range of motion, what we see is these little teardrops here that are difficult to see on screen actually turn to the direction in which they're bending. But as this patient rotates and bends, the joints actually rotate with the curvature. This is an example of what we call a lack of coupled motion. Here again, we see these teardrops kind of right down the center of the spine. This patient is bending to the left, and we see that those teardrops remain perfectly centered down the spine. That's not what we want to see, and this is an example of something that happens very commonly after a car accident and can be described as a sprain strain injury, is the body prevents these joints from rotating as a protection mechanism to allow those joints